Mm-hmm. The difference between what I would do as a homeopath and the traditional allopathic or Western medical approach is that my approach will actually cure or regulate the brain chemistry and the body chemistry of the person so that they won't be dependent on a drug for the rest of their lives. When we hit upon the correct homeopathic remedy, the person's physiology, the actual chemistry in the body, will change, and their symptoms of depression will actually be alleviated, and at some point they'll diminish, and actually go away, so that we're healing the person rather than just taking the symptoms away. In Western medicine, when we use a medication to take the symptoms away, whether we understand it or not in the present time, there's always some type of side effect that occurs somewhere else. Most medical doctors will acknowledge that maybe the sex drive or the appetite might change, but what causes those changes are the effect on the liver or the kidneys and the organs. And later on in life there'll be degenerative diseases from the toxicity because the body has a hard time metabolizing and getting rid of these crude drug medications that are used in Western medicine. Now, I might also at times recommend that a person go to a psychiatrist and be put on medications. I'm not at all against that. In fact, quite a few of my patients who I treat homeopathically are simultaneously on some form of antidepressants, either Prozac or lithium. So it's not that homeopathy and antidepressants don't work together. They do. It's just that the goal at some point, even with those patients, is to get them to a healthy enough state using homeopathy that we can actually get them off the antidepressant too. So I'm taking each patient as an individual. Nobody who comes in do I tell, this is the way you have to do it. You have to go off your antidepressant drug, which a lot of homeopaths would. They wouldn't treat them unless they go off it. But I feel like we have to work as a team, and some people need them to get through particularly difficult times, and then they can go off them. Some people don't need them at all. They just weren't aware that there was any other alternative. So that's part of the intake and history. I try to figure out what exactly this person needs.
Cut for a second. About, would it be similar, would the person have to stay on the homeopathic remedy for extended period of time, or could they get off ultimately?
There's also different ways of treating homeopathically, so that some people might take a single dose of a homeopathic remedy that acts on a very, very deep level and gets rid of a childhood trauma from 20 years ago. And we might not give another dose of the remedy for another 6 months. We'll just give it and let it act. Another person might need a dose of the homeopathic remedy up to 3 or 4 times per day during an acute depressive episode. So there's no basic guideline or rule for how frequently the homeopathic remedies are taken. It depends on the individual how I prescribe the remedies. But basically they will not need to be on the homeopathic remedies the rest of their life. They'll only need them until the healing takes place. And new patients are always asking me, how long will that take? And it's impossible to tell because it's not like Western medications. We're giving basically the same 3 or 4 drugs to each person. There's thousands of different homeopathic remedies and hundreds that are good for depression. So depending on the remedy that's used, which potency is used, and the person's basic psychological makeup, it's hard to say whether it would take 3 weeks, 3 months, 3 years. Well, 3 years would probably be about a maximum it would take. But generally I tell people that they should plan on being on the homeopathic remedies for about half as long as they have had the depression. So if they've had it for 10 years, it might take 3 to 5 years to have a complete cure. But when it occurs, it'll be complete, and they won't need homeopathy again unless they get stressed out or something re-triggers the chemical imbalance.
And what's the success rate?
I've never seen a case using homeopathic remedies for depression that hasn't cured, because it's just a matter of how long it takes. And when we
Okay, cut for a second.
So when we talk about success, everybody wants to know, is homeopathy successful, or how successful will it be? And my usual answer is that I follow the same conceptual model as in psychotherapy, which means that someone wouldn't expect to go into therapy who's been depressed for 10 years and expect to be cured overnight. And they usually wouldn't ask, well, will it be successful? Because they understand that it's a process, that when we're dealing with emotional issues, that it's a process of getting well. It's a wellness process. And it's the same with homeopathy. It's a process of letting the remedies do what they're going to do on a chemical level and an energetic frequency level, and basically relearning life skills as that's occurring. So if someone sticks with this process, they'll receive a cure. There's probably some small percent of people who will still need Western medications, Prozac and this kind of thing, or whatever ones would be good for them. But it's very small, maybe only 5, maybe 10%. It's rare for me to find a case that doesn't respond to the homeopathic remedies.
Are there certain generalities you could make about people that don't respond? I mean, manic depressive.
Yeah. Yeah, I have a case now. I have a woman who's been on lithium and another antidepressant medication for about 10 years. And I'm treating her homeopathically and also with acupuncture herbs, and we're working a lot on her nutrition because she's overweight also. So I'm working on getting her to exercise, cutting out sugar and fats. She's on homeopathic remedies and herbal medications, and I don't even have a goal with her to get her off lithium. But I would like to get her off the second medication that she's on, and she would like to be. But it's possible in her case that she'll stay on those. But she's also feeling so much better since she started homeopathy and acupuncture and herbs. Then I guess what the homeopathy and herbs are probably doing is getting rid of some of the side effects from the medications, if nothing else.
Has she been able to lower her dose, or?
Not really, no. She's had to stay on pretty much the same doses. The hard part with her has been that she's had to change those medications 2 or 3 times since I've been treating her, which has been about 3 years that I've been treating her. And every time she changes the medications, it's always hard to know whether that's what's causing some of her symptom changes or whether it's the homeopathy or the herbs. So I usually cut back on everything I'm doing during those changes until she's pretty stable, and then we start up again. And in her case, I'm ending up treating her less for the depression and more for motivation to get her to change some of her lifestyle things, like diet and exercise and getting out into the world and dating, and working on giving her a little more courage at work to get some job advancement and to move into a better position. And this has been very successful. So I think what I'm doing is kind of using homeopathy more in that way than in actually treating the depression itself, because the depression itself is under control, but yet she still isn't feeling well. I mean, it's just taking care of the bipolar, the manic depressive part, and she's still not really getting motivated to get out there and make these other changes. And I think that's where the homeopathy is coming in.
Okay.